It's also called otorhinolaryngology. You know, oto refers to ear, rhino, nose, and throat, the larynx. Now, I'm going to talk about some common ENT conditions. I'll start. Next slide. About some common conditions. Presence of foreign bodies in the ear, nose, and throat. It's a common condition. By foreign body, we mean objects that are not part of our body, that fell into our bodies, either while we are playing with them or where we are using them. It's a very common condition. You'll be aware of, children around us will have seen one or two putting beads or eraser in their noses and throat, and sometimes fish bone in the throat. It's a common condition, and most time they are often mismanaged even before they get to the hospital, because you see a neighbor who will tell you, I know how to do it. Let's put finger in the throat. Let me use a cotton ball to try to get it out. So by the time they are getting to the hospital, it becomes even more difficult to manage when they have been interfered with at home. Next slide. So these are some of the small foreign bodies out of reach of children age 1 to 6 in the house. Beads and small stones, cell batteries, and the rest. Next. Among adults, the commonest ones are fish bone getting impacted in the throat, and then dentures, that's artificial teeth. Artificial teeth, they are removable. From experience, it usually gets swallowed when people are taking drugs. You want to take paracetamol, you forget to remove it, put the tablet, and when you swallow, you just swallow everything. And it can be very painful. Next, some of the things, the presentation of foreign body in the throat. For example, a child who is seen playing around with an object, healthy and happy, and suddenly you find him gasping for breath, choking and coughing seriously. Then there's suspicion that he may have aspirated something. Next. X-ray, that's some of the things we do to identify the position. That's a knot, a screw in the throat of a child. Next, that's a coin. Next, that's safety pin in the throat. Next, the treatment for the ones we can see directly when the patient opens the mouth, we under good light, we just retrieve it. But for the ones that are gone down, we may need to take the patient to theater for retrieval with special instruments while the patient is sleeping. Next, that's a picture. I'm talking about hearing loss now. That's a picture of the ear. The one you can see here is outer here, but most part of the ear is actually inside, and it's embedded in the bone of the skull. The brain is sitting on the ear, and there's a thin plate of bone that separates the ear from the brain. Grades of hearing loss. We grade hearing loss, it can be mild, it can be moderate, it can be severe. It's the very worst forms of hearing loss we call deafness, the very bad ones. Next. These are some of the causes of hearing loss among children. Disease of a child, of a mother, pregnant mother, can affect the hair of a child. Some rubella and all that. Some drugs taken in pregnancy can affect the baby. Undue exposure to radiation, going to do all sorts of CT scans and other radiations while pregnant. Children who are born prematurely or with very low weight, birth weight, they are prone to have a hearing loss. So that emphasizes the essence of antenatal care. To give your child a good hearing, start from when you are pregnant. These are some of other conditions that can lead to hearing loss. Some form of illnesses like measles, meningitis, then recurrent ear discharge. The hair is always draining. Discharge this month, next month is discharging again, and it's not being treated. Ear infections, then trauma, ear trauma. The commonest form of ear trauma is slaps, in a fight. And most of it occur between family members. My wife slapped, my husband slapped me, my brother slapped me. And then policemen and other hoodlums. These two, I want to talk especially about these two because we see them every day. Ototoxicity, that is the effect of drugs. Drug abuse, unprescribed drug. Go into chemists to buy drugs that is not prescribed. Some of these ones have harmful effects on the hair, especially typhoid malaria treatment. You see people some people almost every month, they say I have been having malaria, typhoid since last year, taking antibiotics every day. They come down with hearing loss. Some of these drugs are antibiotics, antihypertensive drugs, anti-malaria. Noise-induced, that's important too. Exposure, prolonged exposure to loud noise. It can be recreational. All young people walking around with earpiece all the time, listening to music. It can cause it. You go to a party, you sit beside a loudspeaker. It can take away one's hearing. Then, last slide. Okay. The management, what we do, we want to assess the level of hearing loss. We want to know what the problems are. And then some of them are amenable to foreign body in the hair or something, we remove it. Ear infection, we treat it. But there are some medication, but there are some that no matter what you do, no solution. So what we do is residual hearing. Whatever hearing you have left will be aided, augmented using hearing aids. Then some we have to get special education and sign language. Next, that's the throat, infections of the throat, sore throat. It's also a very common condition. Next, it's a common condition, and it's common among children, although sometimes it happens in adults too. Part of predisposing factors include living in overcrowded environments. About 10 of you are living in the same room, and you are coughing to each other's mouth. Malnutrition, not feeding well. Poor oral-dental hygiene. And sometimes from common cold will lead to sore throat, especially among children. Next, it usually starts as a viral infection, but later bacterial infection may take over. Clinical features, patient cannot complain of difficulty to swallow, painful swallowing, fever, headache. Next slide. Sometimes bad breaths. Now what we do in the hospital, when the patient opens the mouth, the red thing in that picture is the tonsil at the side. So what we do, we take a swab, because usually you may have pus on the surface. We take it for a test to find out which antibiotics will work. And then we also do a full blood count just to confirm what we are treating. Next. Now, what we do, pain reliever, take enough fluid. Doctor may need to prescribe antibiotics. I advise that you don't just go and buy antibiotics on your own. You're now aware of the hazards of getting drugs on your own. And then I want to talk about uvulectomy. That is harmful uvulectomy. We are aware of many of us go to, when we say we have sore throat, we go to Malams at Sabo to go and cut belu. The problem are actually the ones at the side. But the people you go to will cut the one at the center, which is not the offending, it's just a bystander. They cut it. Now the hazard of this is, patient may start bleeding, and they don't have solution to that. They will have to go to hospital, and you may find it difficult to see a doctor on time, a specialist on time. Then the knife they use has been used for like 5 people before your arrival, not sterilized. So the risk of infections, HIV, hepatitis, even Ebola, God forbid. So I also want to talk about the special form of sore throat, diphtheria. It's common among children. The problem with it is that it's a killer disease. 80, 70, let me say 60 to 80% of victims will die. The good thing about it is it's a preventable disease by immunization. It's one of the diseases for which our children are immunized. So it's 100% preventable. Next, care of the hair. How do we care for our hair? One, I say, avoid inserting things in your hair in the name of, I want to clean my hair. Car keys, and cotton bud. They're not going to work. You also you push, in the process of cleaning your hair, especially with cotton bud, you push the wax into the hair and bring out just a little. Actually, wax in small quantity in the hair is there to protect your hair from infection and trauma. Use of cotton bud and all that. The other one I've talked about it, slaps. Parents, slapping your children is not the best way to correct them. You just give them an unhandiness problem. Keep going to hospital from time. Once they start having discharging hair, it hardly stops. Keep visiting the hospital for it. And I've talked about how it happens. The other one is ruptured eardrum. Of course, this one also comes from slaps. The eardrum separates the outer hair from the inner hair. When it happens, my advice is keep the hair dry. Don't allow water in the air. No hair drops. You can take paracetamol for pain and report to the hospital. That's a picture of the perforated eardrum. That's a foreign body piercing through the eardrum. Next slide. Ear infections. I think I've talked about it to some extent. The causes, these are some bacteria causing ear infections. And roots, how did the infection get to how do they get into the hair? That's sometimes through common cold, frequent catarrh, especially in children. The nose is connected to the hair. So when they have catarrh, it spreads to the hair. So it should be treated on time before it affects their hair. Most of them get to, sometimes through putting things in their hair and through blood. Predisposing factors, allergy, and co. Next slide. Clinical features, ear pain, mucoid ear discharge. I cannot hear well. My hair is making noise. Among children, it can actually be a reason why a child is having fever, convulsing. You're giving us malaria, is not working. So it may be because of a hidden ear infection. 1 to 2 years children, 1 to 3 year old, they may not be able to tell you. Even to an unsuspecting doctor, he may miss the diagnosis if he doesn't look into the hair. Investigation will take some of the discharge for tests to find out which organism is causing it, and is treated accordingly, usually with antibiotics. Some of the complications that can arise from ear infection, I said that the brain is sitting on the inner ear. There's a thin plate of bone that separates them. So when you keep having, a child keep having infection, ear discharge, it can eat up that bone and then enters the brain. That's a serious problem. It can cause meningitis and even pus in the brain, which sometimes may be difficult to treat. It may require the help of a neurosurgeon. Bleeding from the nose. Bleeding from the nose. That's another topic. It's fairly common. It can be frightening. It's a sign, not necessarily a disease. 70% of them happen without any serious problem. But the remaining can be a warning sign of a serious issue. Can be a warning sign of a serious issue. So, especially adults having nose bleeding, you seek the help of a doctor. It has a very rich blood supply. Next. Causes infection, even from common cold. When you have common cold, running, yellow discharge, sneezing excessively. You can easily rupture a vessel and start discharging. Allergy. There are some people that any exposure to little perfume, dust, they sneeze and sneeze and sneeze. They can lead to. Now, trauma. Children putting foreign body in the hair, cotton bud, ear pain. Nose picking is the commonest among children. They are in the habit of picking their nose. So the finger injures the nasal cavity. Facial trauma, injury, fall from a bike, hit the face. Then could be iatrogenic, that's in the hospital following surgery. Yes, I said it can be a warning sign because some form of cancers of the nose, inside of the nose, will present with nose blockage, runny nose, and then sometimes bleeding. Next. I also want to mention high blood pressure, hypertension. It's a silent killer. And, you know, it's a silent killer. It hardly worries people until it comes suddenly. So if one is lucky, it can come with headache, my heart is beating fast, and one of it is nose bleeding. It can be somebody who has never been diagnosed hypertensive. When you get to hospital, it will be diagnosed. Also, the ear, ringing, my hair is making noise. It could be a warning sign of high blood pressure. Drug-induced. Drugs, stuffs in the nose, too much nose drops, inhalants, tobacco, cannabis, woodworkers, carpenters from the too much dust. Next, the general causes, other causes. Some people are prone to bleeding. Little thing, they are bleeding. Bleeding disorders is a problem. Some drugs can be side effect of some drugs, especially too much strong pain-relieving drugs, aspirin, ibuprofen, cataflam. Cancer of not just the nose. There's some cancer of maybe of the blood, leukemias, and the rest. Hypertension, I've mentioned that. Then, why I emphasize there can be a warning sign of a serious underlying problem. People with chronic kidney disease, the one we call renal failure, chronic liver disease, they have problem with blood remaining in their body, not they have problem with clotting. Next, investigations. We want to carry out some tests, how much blood is left in the body, and can the cause be picked in the blood? We try to find out that, and then we check the nose itself for whatever may be causing it. There may be need for X-ray and CT scan. And then, next slide. The patient should be treated accordingly. What we do, yes, this one. What we do, we want to stop the bleeding. It can be very frightening. Stop the bleeding. Then we try to identify the cause, what's causing it, and then we treat the cause. Thank you for listening. I think I've within the time.
Let's put our hands together once again for Dr. Afuye. Do we have any question? Okay, I guess they are written down. Ushers, please assist to get those 2 questions from our brothers. Any other one? Okay, from Sister Aditaya also. Any other question? Thank you so much for writing down your question.
What causes the hair to infect, and what can we do about it? Is that correct? The person that What causes the hair to itch? Okay, what causes the hair to itch and what can be done about it? One, too much wax getting stuck in the hair could cause the hair to itch. Especially when you have in the habit of using cotton bud and you push these things inside. Sometimes it's a sign of infection, like just starting. Then there's another condition we call allergy. Allergy, those that sneezes excessively on exposure to certain things like perfumes and dust and smokes. So it's not only they have itching in the nose, in the throat, and also in the ears. Sort of cleaning the ear. Please explain the medical method of cleaning the ear without using cotton bud. Well, in the course of my training, I was told that a professor was asked this same question by maybe a patient or some of his students. And his reply is that the best way to clean your hair is to use your elbow or your knee. So by that, he's trying to tell you that don't do it. There's no need for it. The hair it has self-cleansing ability. It can clean itself. And I told you, it has a way of pushing out excess wax. And I told you the little one you have there even has some function. It protects the hair from infection, from bacteria outside to come inside and overgrow. You know, it makes the place unconducive for disease-causing germs. So, no need for it. If you feel your hairs are clogged, just visit a doctor. Some severe over. Please, what the person do so that it will affect. If someone below the age, sorry, I can't read down. What is the connection between GARD, that is GRD, we call it gastroesophageal reflux disease, and throat? I have esophageal mild esophagus atrophy according to the result of endoscopy, but the main symptoms I'm having after treatment is discomfort in my throat to the hair, I think headache, and a gastric doctor. Told me it was irrelevant to my gastric conditions. What we call GERD is gastroesophageal reflux disease. That is, he said, what's the relationship between that one and the throat? Acid is produced in the stomach, partly for digestion of food, and it's only the stomach that is designed to handle acid. You pour acid on paper, it will burn, but the stomach is designed to handle it without causing injury. But in those that have ulcer, they produce excess acid. And this acid sometimes flows back through the food passage into the throat. And for some other conditions, apart from excess, maybe the opening, entry to the stomach is loose. So the content reflux comes out. So it causes when it gets to the throat, it burns, it comes from injury, it comes from mild burns. When it happens repeatedly, you continue to present a complaint of pain in my throat that is not going, for months. And the relationship to the ear is that whatever pain one has in the throat, it can be felt in the ear. In fact, 5% of the time we complain of pain in the ear. The cause of the pain is not in the ear. Is somewhere else. Neck pain, those in cervical collar, they may feel pain in the ear. Sore throat, you may feel pain in the ear. This excess acid causing trouble in the throat, we call it referred pain, referred otalgia. So the issue you have in your throat, maybe, I mean the ear, I think is directly related to, or maybe related to the GERD, conditions of the throat.
The question is, I don't know whether it's related to our topic, is if someone gives you a blow in the eye,
Yes.
what can the person do to avoid future effects? Blow in the eye.
Okay.
But you also have this,
Okay.
what is the cause of noise in the
Yeah.
hair, especially the right hair?
Okay.
Then the last one is
What age?
do you do, what age do you stop
Swimming. What? Okay.
Questions are giving back to questions. I've taken 2 more, so after this, no more. Dr. Afuye will be available after the service. You see him.
What age do we stop swimming? Well, the relationship between ENT and swimming is that swimmers are prone to having ear infections. Ear infections. The reason being that sometimes the chemical in the water to sterilize the water, as it irritates the eye, it can also irritate the ear. And also, in public swimming pools, some children pee in the water, so it's infected, and this bacteria gets into the hair, can cause a cause of ear infection. Between age and swimming, I think people can, I mean, too young people, what I can say, people who are too young or too old should not swim, because they may not be able to control themselves even when they know how to swim. Too weak to swim. What's the cause of noise in the ear, especially right ear? So many things. Everything I mentioned about the causes of hearing loss can also cause noise in the ear. From foreign body in the eardrum is perforated, and too much noise. Those that work in the, I was going to say that, apart from recreational, occupational hazards, those that work in the factories, they are meant to protect their ears, you know, but sometimes that is not done. And by the time you work 8 hours every day for 5 days a week, and loud engine running can cause hearing loss. When the hearing goes, it's replaced with noise. I mentioned high blood pressure. High blood pressure can be a cause too. The ringing in the ear. The heartbeat. When we say high blood pressure, the heart is beating too fast. So the force of beating, you hear in the ear. Drugs too. Drugs for especially typhoid. I keep talking about that because it's very common these days, and there's a need to create public awareness concerning it. Don't just go to chemists to buy drugs when you have typhoid or malaria. Go to a standard hospital. If someone is hit or receives a blow on the face below the eye, what can the person do to prevent future problems? Well, on the face, there's what we call sinuses. They are empty spaces in the bones of the face. Bones of the face. They are all centered around the nose and the eye. Some people argue that they are there to make the head light so that the head is not too heavy, because they are empty spaces. So, and they also protect the brain and other structures in the eye, so that empty space, you have some on the forehead, something hits somebody on the forehead, the space will absorb it and collapse first. So we have some on the cheeks too, just below the eye. So, what can happen depending on the extent of that blow? It could just cause soft tissue swelling, just the flesh becomes swollen and painful. That one can be treated easily. But if it's strong force, it can cause a fracture of that bone. And most likely the patient will present with what we call black eye. The patient will present with black eye, and If it impinge on the eye, itself, it can cause some blurring of vision, person not seeing clearly. And the eye can sink into the cheek and become smaller, impairing vision. So the nose bleeding, blood may start coming from the nose is blocked. So I think if it is that serious, one should see a doctor to present to the hospital. There may be a need to do an X-ray to find out the extent of the damage, and just like other broken bones in the body, the broken bone can be fixed. Thank you.
Let's put our hands together very well for our brother. Thank you, Brother Bayode. Thank you. Please have your seat. We will take the choir rendition now, and we go on with the rest of the program.